Good morning, everyone. Thank you for joining us this morning. We are thrilled to be here to welcome you all and to debut Groundwork Ohio's 2025 Early Childhood Data Dashboard. We'll give it just a second for some people to trickle in, but as we are kicking off today's presentation, I want to give a little introduction to Groundwork Ohio for anyone who may not be familiar with us. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization. We were formed in 2004 and we champion high quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio's kids, families, and communities. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Just a little bit about some housekeeping items to be aware of today. This webinar is being recorded and closed captioning is available in your Zoom settings. All participants are muted, but we ask that if you do have questions that you use the Q&A function. If we're not able to get to your request or your question during the event, we'll follow up afterward if you provide your email address and contact information along with that. And finally, all participants will receive a recording of today's webinar along with materials shared via email after the event has concluded. This is just a brief overview of our agenda for today. Next, we will hear from Linan Gutierrez, our President and CEO, who will talk through the purpose and intent behind our early childhood data dashboard. We'll also hear from Troy Hunter, our Managing Director of Communications, who will provide a thorough guide for how to read and interpret the dashboard. And we're also thrilled to be joined by Carrie Almasi and Lexi Chiricos from Health Policy Institute of Ohio as our technical experts. And they will speak about the methodology behind the early childhood dashboard, as well as participate in our panel discussion later in the hour. So again, welcome to everyone. Thank you so much for being here. And without further ado, I will transition over to Linan, our President and CEO, to really start us off. Linan?
Thanks, Caitlin, and good morning, everyone. We are back 2 years later with a 2025 edition of the Early Childhood Data Dashboard, and we're excited to have you with us. This represents an immense amount of work for our team, and we are thrilled to share it with you because we know how much this particular product is utilized among all sorts of different stakeholders. And for us, both in our external work and our internal work, we are constantly asking ourselves how we measure success. How will we know if Ohio is the best place to be a young child and that every child has the opportunity to reach their full potential? That represents the work, our mission work, and our vision for the state. And we really utilize the early childhood data dashboard to understand where we're making progress, where there may be opportunities, and whether we're growing and making success in terms of our policy advocacy work across the state. So we're happy to make this 2-year commitment every 2 years to share updated data and a more complete picture of what it means to be a very young child in Ohio, and how families are experiencing the systems that we all work together so hard to create and improve. Next slide. So this graphic demonstrates, and many of you've seen, this is our policy framework. So how do we get to our vision there on the right-hand side? The evidence tells us, and the evidence behind our mission, which is grounded in the science of early childhood development, where we know 90% of brain development happens in those first 5 years. The evidence tells us if we invest smartly in factors that build a strong foundation for young children in the first 5 years of life, including early learning and childcare, healthcare access and quality, early childhood trauma prevention, and economic stability for families, that we will see the outcomes then that indicate Ohio has a strong foundation for young children, and we'll see outcomes for young children in Ohio improve. We'll see more young children that are healthy and ready to learn that ultimately achieve our vision. So this policy framework you will see in action through our data dashboard as we really focus on, next slide please, those environmental factors and four categories of data that we've organized for you to show whether or not we're making progress. I shared with you just a reminder about the brain science of why our mission is focused on very young children. And certainly we have been working over our past 20 years at Groundwork to make public policy keep pace with the brain science, because we know it's not just the right thing to do for children and families. It holds the potential to improve outcomes for young children and families through the life course, but it's also really smart policy from an economic standpoint. So this is a kind of famous graphic in our world. This is what's called the Heckman curve. A Nobel laureate economist, James Heckman, shares this graphic to show that for every $1 public in state investment, we can see a 13% return on investment. And it's strongest in those first 5 years. So that you can see the strongest investment or return on investment is happening in those prenatal programs and the birth through 5 space. And that is because investments in that strong foundation that we talked about are reaping benefits, not just in the short term with better outcomes, whether it's in infant mortality, kindergarten readiness, less engagement with special education when the child begins kindergarten. It is also reaping benefits throughout the life course. So more positive benefits like high school graduation, gainful employment, less reliance on public benefits, and then less of those things that really harm families, children's, and communities, like engagement in the juvenile and adult correction systems. So we hope we set this stage for you just to remind us of why Groundwork is focused in these early years, why smart public policy matches what we know around brain science and development. And there's a lot of really rich information to help continue to share that story with the latest evidence in the dashboard of why we invest in young children and where Ohio should invest moving forward. Next slide. So just a reminder that these are the kind of 4 categories of environmental factors that we're kind of testing for. We're looking at data we're asking families about all the time as a way to measure and benchmark success. Next slide. And you'll see that carried out through the release of our dashboard. So a little drum roll in my office that this is the official release. Our team will drop the link to the chat. This is the website you will see. That is the new home of the updated dashboard. You can still be able to see our previous dashboard if you're curious there. But the sections are organized. You'll see an introduction and overview, and we'll walk through step by step of these sections, but that they're organized by these 4 categories of environmental factors in terms of the inputs that we're looking to see what kids are accessing, how families are experiencing our systems. And then really looking in section 6 and 7 to what are the outcomes? Are kids then more healthy and ready to learn in Ohio? And finally, a summary section, section 8, around our strengths and challenges. Next slide. So I've had the opportunity, and our team's had the opportunity of, with quite literally almost 2 years of work going into the product that we hope you get to sink your teeth into soon, around, what's the bottom line? What's the story here? And Troy's going to share in a little bit kind of the executive summary of what we've seen from the data. And I was just really struck, and it may not surprise you all, that the story here is we haven't seen the type of change that we are seeking and that we're advocating for every day. And certainly in systems change work, not seeing the type of change you want every 2 years, perhaps is not surprising, but we really believe that we need to keep focused on our learnings to make sure that we are able to make that long-term progress. And if we don't prioritize it now, we can't expect that the outcomes will be any different in the future. And so while there's been some, improvement, and certainly a lot of our data reflects some policy change during the pandemic period of time. And as we come out of the pandemic, the two things that I wanted to leave you with today in terms of what can Ohio do differently, the answer seems pretty clear in terms of our learnings. And that is, one, we have to invest in proven solutions, and we have to invest boldly. We can't just act around the margins. And this was a real reflection, both in terms of the data that you see before you, but working alongside of all of you in state systems every day, is that we have a lot of really well-intentioned policy change and professionals that are working in programs and in systems every day. And despite all of that, we haven't achieved those meaningful population level changes in the way that we'd like to see on key early childhood outcomes, whether it's infant mortality or kindergarten readiness. And so the state really has to commit to bold goals matched with priority investments and those proven strategies to ensure kids and families, that those are reaching kids and families. One promising step that is really encouraging for us as we've been reviewing the governor's executive proposal for this biennial budget is the proposed child tax credit, because that child tax credit would invest $890 million over the next 2 years of new revenue back into the pockets of working families with young children. So this is a perfect example where the level of investment meets the scale of the challenge and not just around the margins in terms of getting money back into the hands of working families. As we've traveled the state and we've met with you and we've heard from families time and time again, economic stability rises to the top. Parents are just getting by, and we really are excited that there is the appetite to at least consider what a nearly $1 billion investment would look like for our families. And we think it's really a really smart policy in terms of matching the need to the level of investment in the budget. The second piece is that parents are and I touched on this before, parents are the experts in their own experiences, and their voices have to drive policy solutions. So when I say we're hearing from parents, it's not just because we're looking at state agency data or national data sets. We are talking with families. This body of work in the dashboard represents deep family stories. It represents surveys of nearly 3,000 parents in Ohio. You know that we do some excellent polling that we released earlier this year with and we always intentionally oversample parents. We also have a family action network in Ohio that is really dynamic, and we can tap into real-time relationships we have with families. And I list all these ways that we're listening all the time to say and affirm that the family's top concerns are certainly affirmed in this data. And so when we think about then matching policy and priority, we really need to listen to them. If their top concern is financial security and meeting basic needs, this common story that we're just getting by, we're living paycheck to paycheck, we lack affordable childcare. We know that remains a major barrier to work and financial stability. Investing in childcare directly addresses these concerns and removes barriers to work so that more families can thrive in our state. And I know that we've shared in some of our other programming before, but we know when we have great examples in the state that when we actually listen to parents and have parents drive the solutions, that we can see change in the population level data. So when we think about reducing infant mortality, we know that local efforts have shown success. Cradle Cincinnati, for example, has cut Hamilton County's overall infant mortality rate in half, from 10.2 deaths per 1,000 down to 5.5 deaths, which is the national average, and the Black rate by nearly 50%, narrowing that racial gap. And they've done that by centering solutions around mom's experience. So offering us a lot of hope that if we listen to families and scale this type of collaborative parent-driven model, that can be key to the meaningful change that we seek on these population metrics that for so long we have said this, this is stubborn. How can we change this? Is it possible? And the answer is yes, we can change it. There are possibilities, and it requires us to listen to families. So as policymakers consider these findings, which is our primary audience, even though many of you will utilize this work in various different ways, we hope this is and continues to be a call to action to invest boldly and implement parent-driven policies. If we can do those two things, we know that we can see more change, more improvement versus maintaining the status quo or lack of change. And in some cases, you'll see, or many cases, unfortunately, there are conditions that have worsened for young children and families, and even greatly worsened over the course of a couple years. So thank you for letting us share about kind of our insight of what the data tells us and what Ohio can do differently. Our team is now going to walk you through the report so you can get an insight of little nuggets that hopefully will invite you to engage more with the data. Thank you.
Thank you, Linan. We're really excited to be able to walk through this dashboard with you. This has been 2 years in the making, looking at different data points, thinking through what data do we need to collect and put together to paint the picture of what families and children are experiencing in Ohio. In section 1 of our dashboard, you'll find the introduction and overview that includes a message from leadership about our work, how we navigate the data, and you'll also find our key findings and in our executive summary. If you can go to the next slide. So in our key takeaways, like Linan mentioned earlier, none of this really comes as a surprise. And if you've looked at our 2023 dashboard, you might have even seen some similarities in the key takeaways. And the takeaway from that is that we haven't seen a lot of change in the areas that we need to for kids and families. Next slide. So our first key takeaway is too many Ohio kids are falling behind before they even set foot in a kindergarten classroom, and the gap only widens from there. Kindergarten readiness, if you want to go to the next slide, is a critical predictor of long-term success. Research shows that children who start school ready to learn are more likely to succeed in math, reading, graduate high school, have secure and stable employment, and early investments in high-quality early learning experiences are key to preparing children for success. The Ohio Department of Children and Youth recently released a brief where they've been tracking the first cohort of KRA, kindergarten ready assessment students who are now in 9th grade, and have seen connections between those who show up ready to learn in kindergarten are showing more academic success later on. We're facing a kindergarten readiness crisis with over the last 2 school years, kindergarten readiness has dropped by 16%, meaning more children are entering school without the foundational skills needed to succeed. Today, 65% of all Ohio kindergartners are not considered ready to learn when they enter the classroom. And economic disadvantage makes the gap even wider, with among economically disadvantaged students, nearly 8 in 10, 79% start kindergarten not ready to learn. Go to the next slide. Second takeaway is that Ohio moms and babies are facing a crisis with alarmingly high infant mortality rates. Go to the next slide. Ohio's infant mortality rate remains too high. Despite progress in reducing infant deaths among white infants, Ohio's infant mortality rate still exceeds the national average of 5.6 deaths per 1,000 births. This racial disparity is alarming, with Black infants being more than twice as likely to die before their first birthday. Maternal deaths are rising and are preventable. Maternal mortality in Ohio has increased by 17% between 2011 and 2021, with research showing that 80% of these pregnancy-related deaths could have been prevented. Addressing this crisis requires greater investment in maternal health care, parental support, and postpartum services. Go to the next slide. Another takeaway that we found is that Ohio's youngest children experience profound trauma during their most critical years of brain development. Early trauma has lifelong consequences. Exposure to adverse childhood experiences such as abuse, neglect, and household instability negatively impacts brain development, health, and future well-being. Research shows that children who experience multiple ACEs, adverse childhood experiences, are at higher risk for poor educational outcomes, chronic health conditions, and mental health challenges. Ohio ranks among the worst in the nation for infant maltreatment. In 2022, over 3,000 infants under age of 1 were victims of maltreatment, ranking Ohio 30th out of 50 states in DC. This is an urgent crisis. Our fourth takeaway is that Ohio families with young children struggle to cover the basics. Too many Ohio families with young children are struggling financially. Nearly 1 in 5 children under age 5 live in poverty, limiting their ability to access safe housing, nutritious food, quality childcare, and healthcare. We can go to the next slide. Basic needs like food are out of reach for many families. Nearly 30% of Ohio's youngest children live in households that cannot always afford nutritious meals, increasing their risk for developmental delays, poor health, and learning difficulties. Ohio ranks amongst the worst in the nation for child food insecurity. And according to the Prenatal to 3 Policy Impact Center, Ohio ranks 44th in the US for children experiencing food insecurity. And our final takeaway, there are family voices behind this data that are the experts of their own experiences and solutions to their greatest challenges. Behind every data point, there is a real family. Numbers alone don't tell this story. Ohio parents and caregivers are the experts on their own experiences and should have a central role in shaping policies that affect their children's life. Too often, families' voices are missing from decision-making. Parents and caregivers want stronger connections with systems they rely on, but many feel unheard. Engaging families in policy conversations ensures that solutions are responsive to their real needs. When families are involved, policies are stronger. Research shows that amplifying family voice leads to better outcomes, not just for individual children, but for the entire early childhood system. Listening to parents is a key way to change. By centering family voices in advocacy and decision-making, we can drive policies that truly support Ohio's youngest children, strengthen families, and create a more equitable future for all of our children. Go to the next slide. We're now going to pause for questions from the press, and I'm going to turn it over to Linan.
Thanks, Troy. If you're a member of the press, we just want to prioritize your time. If you have any questions, you can take yourself off mute and ask. For our other attendees, we have an opportunity to ask questions at the end of our session, or you can do so in the Q&A function on Zoom. So any members of press, if you want to step off and ask a question at this time, please do so.
You can do that by raising your hand, and then we will unmute you. We'll pause for just a moment.
Thanks, Sarah. Let me know if you see any hands raised at this time before we move forward here in a minute.
No hands. I think we can proceed.
We do have one hand from Laura H. Laura, if you'd like to come off of mute.
Can you hear me?
Yes.
Yes.
This is Laura Hancock from cleveland.com. What makes you ready for kindergarten? Can you explain that?
Sure. So really the only statewide way we know what makes you ready for kindergarten is the administration of the Kindergarten Readiness Assessment, or the KRA, which is required of all incoming kindergartners. It happens at the very beginning of the kindergarten session and allows certainly the teacher, the schools, and us as policy advocates to get a snapshot of whether or not kids are ready. There are 5 different domains that are tested in a developmentally appropriate way for those students. I'm happy to provide any more detail, and Troy has expertise in this space as well. Does that answer your question?
I'm guessing if you go to preschool, you might do better. Like, what makes a kid do better?
Sure. So, I mean, we ask ourselves that a lot, because if you're having quality learning experiences in your first 5 years, we know it particularly from our local preschool initiatives like Pre-for-Clee in your community, like Dayton, Montgomery County Preschool Promise, Cincinnati Preschool Promise, is that when you have access to preschool, you do score better on the KRA. So you are more likely to be ready for kindergarten. And you see movement within the 3 scoring bands of the KRA. Our data reflects demonstrating readiness. There is approaching and emerging. And so we see students who have those preschool experiences more likely to be demonstrating, and also more likely to have movement from approaching to emerging in those first 2 tiers.
With seeing no more raised hands, we will move on to the next portion.
Thanks. And also with regard to Laura's question, Troy shared we have seen decrease in overall kindergarten readiness, and certainly for our low-income children. We saw during the pandemic less children engage in quality preschool environments. And so that is part of the story, we believe, and why the data has trended down. So I think that continues to affirm that when you have these high quality experiences, certainly they can happen in the home, in a family childcare setting, in a childcare center, or in a school-based setting. But the more children, particularly those who don't have access to other high quality environments, if you're in those programs, you do better at the kindergarten level.
I do have one more raised hand from Chloe. Chloe, if you are a member of the press, if you'd like to go ahead.
I am not a member of the press. I apologize. I did just want to say that I have 4 children. 3 of them went through Preschool Promise and 1 did not. And some of it was during the pandemic, but there is definitely a very obvious difference in how they handled kindergarten, not just from an academic standpoint, but from a social emotional standpoint as well.
Thanks so much, Chloe. And you're a parent. And so again, what a wonderful opportunity for all of us to listen to parents on this webinar today. We couldn't have planned any better, and we're so glad you use your voice to share. Thank you.
Thank you. And as we move on, there should be maybe some time at the end for questions if any more arise. And thank you for sharing, Chloe. And it really talks to why family voices are so important. We know what the data says, but what's the story behind that? What's the perspective? As you navigate the dashboard and as the link's been dropped in the chat, you'll see these tables, and the tables on the dashboard provide a data summary from a variety of different sources that measure important indicators of child health and well-being. Ohio's performance on these indicators are displayed in the graphics and summary tables like the one here. Next page. And here you'll find data alone doesn't tell the full story, or at least quantitative data. Family voices must be a part of the conversation. Through our Family Voices project that we launched in this past year, we've been able to do 2 surveys. Survey 1 was in the field in April of 2024, and we had over 750 parents that participated in that. Survey 2 we did in the fall of 2024 and had over 2,700 families participate in that survey. So whenever you see a microphone that in the dashboard, that highlights real family stories. It brings human perspective to our data and illustrates the everyday challenges and successes of Ohio families. These stories provide essential context to the statistics that we're providing. So if you see we kind of played an I Spy game here in the dashboard. So when you go around and you spy a microphone that comes from our data, 2 of our surveys that we did in this past year. We also have these light bulb icons that encourage deeper engagement with the data. It singles areas where stakeholders should reflect on trends, gaps, and the broader implications of the numbers, and helping to identify meaningful policy solutions. For example, some of the data, there's questions to be posed there. We list about children enrolled in preschool. The data that we were able to have in this dashboard doesn't include, and we have a light bulb in the dashboard, it doesn't include the historic investment that Ohio made in early child education grant slots and in giving more access to over 11,000 preschool spots for preschoolers. So we have areas throughout to help reflect and give context to the gaps in the data. And with that being said, I'm going to turn it over to Caitlin to go through each section and go over some key data highlights.
Thank you, Troy. Yes, so I'm going to go through the next few sections with you all and just share a couple of high-level overview points. Certainly there's a lot more details in the dashboard itself, but we extracted just a couple of things for each section that we think are important for everyone to be aware of. So first and foremost, starting with early learning and childcare, we know that childcare is an essential support for working parents, but accessibility and costliness of quality childcare is a significant barrier for many. So we found that the average Ohio household with 2 children spends 29% of its income on childcare. And what's more, 308,890 Ohio children between the ages of 0 to 5 from families with low incomes below 200% of the federal poverty level did not have access to early learning programs in 2022 to 2023. And this has resulted in an estimated unmet need of 46%. In section 3, we're looking at healthcare access and quality. So similar to childcare, when we look at healthy development for young children, we consider both healthcare access and quality. Access to both quality preventive care and timely treatment is essential to support children as they develop and as they grow. And access to early prenatal care is an important tool to detect and treat potential challenges or complications during pregnancy. In 2022, as you can see here, nearly 1 in 4 pregnant women in Ohio did not receive prenatal care in the first trimester of pregnancy, with pregnant women of color being far less likely to receive timely prenatal care when compared to white Ohioans. And in addition, on the right-hand side here, you can see, and you know what, I'll add one more point too, that a lot of Ohioans live in areas without any access to maternity care, obstetrics, or gynecology providers, and this includes 13 counties we found with 0 providers available. So this really forces families to travel further for care, and this is a particular burden for those living in rural and Appalachian areas of the state who experience transportation barriers. So then moving over to the right-hand side of the screen here, we know that home visiting programs offer highly effective and prevention-oriented approaches for both expected parents and parents of very young children. So although 12,436 Ohio families were enrolled in home visiting programs in 2024, many more families are in need across the state and are not benefiting from home visiting services, although they may qualify. So we found in 2024, only 8.8% of families in need of home visiting services were receiving them. Next slide, please. In section 4, we dove into early childhood trauma prevention and really showing factors that contribute to childhood trauma as well as prevention strategies. Next slide, please. We know that healthy development for Ohio's youngest children includes both physical and mental and emotional well-being. Mental health begins during the prenatal period as fetal brain development is inextricably linked to the mother during this time. So we know that traumatic experiences during pregnancy can have a negative impact on fetal development. And as you can see here on the left-hand side of the screen, 35% of women experienced emotional stress and 47% experienced financial stress during pregnancy. This data is disaggregated and shows that Black women are more likely than women of other races to report experiencing emotional, financial, and other traumatic events during pregnancy. Troy mentioned earlier that exposure to adverse childhood experiences, or ACEs, such as abuse, neglect, household challenges, and other traumatic exposures, which can include things like experiencing racism or food insecurity. We know that these can have really devastating consequences on a child's development, especially during that critical period of development from birth to age 5. So where exposure to one adverse childhood experience equates to 1 point, a child with a score of 2 or more is more likely to qualify for special health care needs or repeat a grade at school. And we found that 14% of Ohio's children ages 0 to 5 experienced 2 or more ACEs, with children of color and those living in lower income families being more likely to have experienced 2 or more ACEs than their peers. Next slide, please. In section 5, we take a closer look at economic stability for Ohio families, and this includes financial challenges faced by families and the impact of those financial challenges on children's well-being. Economic stability plays a vital role in a child's access to care, resources, other basic needs, and when families are economically stable, their children can grow and thrive. In 2022, 1 in 5 Ohio's children ages 0 to 5 lived in poverty, and 1 in 10 lived in extreme poverty. On the right-hand side, we have this graphic showcasing those who are eligible for and those who are receiving WIC. We know that secure access to nutrition is one of the most fundamental elements to achieve positive outcomes in other aspects of life. Without access to basic needs like nutrition, children face significantly greater challenges in reaching their full potential. We found here that only 27% of eligible children ages 1 through 4 were receiving nutrition benefits through the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC, compared to the national rate you can see of 43.3%. So again, that's 27% of eligible children were receiving WIC benefits in Ohio compared to that national rate of 43.3%. And the percent of children ages 1 through 4 who were both eligible for WIC and receiving WIC benefits actually decreased by over 20% from 2019 to 2022. Next slide, please. From our research, we asked ourselves the basic question: are Ohio's children healthy and ready to learn? Next slide, please. While the number of Ohio women who smoked cigarettes during the last 3 months of pregnancy declined between 2020 to 2022, e-cigarette usage during the last 3 months of pregnancy actually tripled during that same time period, 2020 to 2022. And Ohio has nearly double the national rate of children with elevated blood lead levels at 5.2%, and that's compared to the national rate of 1.9%. We know that there is no safe blood lead level, and lead exposure disproportionately impacts communities of color and those living in poverty. Next slide, please. Finally, are Ohio's youngest children ready to learn? Next slide. We found here that less than half of Ohio kindergarten students were on track for language and literacy during the 2022 to 2023 school year, and 23.5% of students in grades K through 3 missed at least 10% of school attendance time in 2023. I will now turn it over to Linan Gutierrez once again to continue the conversation. Linan?
Thanks, Caitlin. And our team and myself has been feverishly responding to the questions in the chat. We'll be sure to get to those at the conclusion of our presentation as well, if we haven't yet. So I just want to round out, bringing us back to some of the points I raised earlier about the bottom line, or the takeaway, that we need to make bold investments in order to see change in many of these metrics. And we also need to really listen to parents and have them come alongside us, co-creating solutions, both as the experts of their own lives and then the best advocates for their own lives moving forward. So when we look at Section 8, just want to invite you to take a look at what is really a summary of all of our metrics where we have available trend data. Next slide. So the first thing you'll see is we've pulled out 6 metrics where we're able to provide a state ranking from a variety of sources. And this really shows you kind of where some priority needs to occur in terms of where we are in the bottom half or bottom quartile of 50 states and DC on these measures. It's really humbling when we think about many of these metrics, early Head Start access being available to our very youngest, our babies and moms, certainly our childcare subsidy eligibility. We continue to have the lowest eligibility in the country, notwithstanding the governor's investments in the childcare voucher program, which we support. Infant maltreatment, so abuse and neglect of an infant under the age of 1, continues to be a unique problem for our state. Early childhood poverty, food insecurity, and then we've talked quite a bit about infant mortality already. One of the interesting things is where you see we're ranked 40th for poverty, you'll also see that early childhood poverty appears in one of our strengths. So you have to take kind of all of this data together to and acknowledge the intersections and get curious about them to understand fully what's going on. And we hope that all of you will help us understand this data more. So a great example is if we're ranked 40th for early childhood poverty out of 50 states and DC, you'll also see that our early childhood poverty rate improved over the time of the data that's been analyzed. We've offered some question and discussion in the report about impact of some federal policies that may have accounted for some of that improvement. But we're humbled that even in spaces where we have improved, like that poverty rate, that we continue to not keep pace with other states in terms of the experiences young children are having. So You can view those strengths, any trend data that is available to us that is either improved or greatly improved. And the vast majority of the trend data that was available for the metrics we've been looking at over the course of both this dashboard and previous dashboards is that there hasn't been change. So there hasn't been any significant change. And in some instances, you see in those what's highlighted in red is that the trend data has worsened. So the number has worsened or even greatly worsened. So that color is a trigger for us to attend to it more urgently. But I'm equally concerned about all of these metrics where we haven't been able to make any change. Next slide. So a few ways you can act today in terms of in terms of how you can utilize this tool. If you haven't already thought about it already, we've gotten some questions in the chat. Can we use the slides? How do we, share this with our community? And so that is a great segue to please share this resource. Think about who needs to see the dashboard internal to your organization or your family or your community. And then also think bigger. How can you use this to share it with policymakers? How does this allow you to tell a more full story of how your experience in your community isn't unique, in fact, and that we really need statewide priority on the issues that you're concerned about? So feel free to share the link. Certainly you can do that on social media as well as in person. Certainly compare. So, use this tool to identify the needs of our youngest children and families and compare it up against our proposed state investment and policy change. We already have the ability to do that in the governor's budget, his executive proposal. But as the budget continues to move through the process through the House, through the Senate, and then all the way to conference committee at the end of June, this can be a measure. I mean, folks have lots of priorities, policymakers have lots of priorities, and we're holding them accountable to their investments in young children and families. And we invite you to help us in doing the same. And this is a great tool to help do that. And then finally, engage and educate your policymakers. Add to the story that the dashboard tells by sharing your story, your expertise, your experience as constituents in their communities. Whether or not you voted for any particular legislator, they represent you. They need to hear from you. I promise you they will hear from us. And one way that you can really do this is joining us on March 12th. March 12th is our biennial advocacy day at the State House. There is not a cost to participate, so please, our team will drop the chat to register. I will say registration is filling up. We only have the ability to accommodate 400 people in the State House, but we'll have a really robust day to share with you. And that will include a program followed by us coordinating meetings with your policymakers and supporting you to be able to have a quality meeting with your representative or their staff on that day. Next slide. All right, I'm honored to hand it over to the HPIO team to share really with their technical expertise about the dashboard and certainly their rich contributions to the product you are exploring now.
Thank you, Luann, and thank you to our friends at the Groundwork Ohio team for inviting us to join today. I am here with my colleague Lexi Trakos, and I'm Carrie Almasy, the Director of Assessment and Planning at the Health Policy Institute of Ohio. Here's a little bit of information for those of you who might be unfamiliar with HPIO. Next slide, please. And these are our core funders who advance our mission with their steadfast investments in our work. Next slide. We've had the sincere pleasure of partnering with Groundwork Ohio on the Early Childhood Dashboard for almost, 4 years now. We started working together on the dashboard preview back in 2022 before the release of the first early childhood dashboard in 2023. Our role throughout this process has been to support Groundwork Ohio by analyzing data from dozens of different public and private sources. And Lexi and I are going to touch really quickly on a bit of that methodology in today's webinar. Next slide. To identify potential metrics for the dashboard, we reviewed a wide range of public and private data sources, such as data from state and federal agencies. And then we compiled a list of 381 potential metrics for consideration. From those, we selected 63 metrics to include in the dashboard. Previous slide still, please. Thank you. We use the criteria shown here on the screen when making those decisions, but to keep us moving, I'm not going to cover all that detail now. All of that detail and more is available in the methodology report on the dashboard website. Now I'm going to hand it over to Lexi, who's going to talk a little bit more about how that data shows up in the dashboard.
Thanks, Carrie. My name is Lexi Trakos. I'm the Policy and Data Management Specialist at HPIO. The Early Childhood Dashboard contains 63 metrics broken up into 6 conceptual framework domains, each with a total of 16 subdomains. So this is how the data that HPIO provided shows up in the report. You've already seen this table so far, but we're just going to walk you through quickly how to navigate the tables and just explain some of the methodology behind the analysis. So within each subdomain in the laid out document are tables which display metrics. Each metric has a short description of that data point, and then we have baseline data, which was previous data either published in the 2023 Early Childhood Dashboard or pulled separately. And then we have data from the most recent year, and the years are listed underneath each data point. We also display trend. Next slide, please. So in approximately 67% of cases, the value was the same from the 2023 Early Childhood Dashboard, and the rest of the time it was updated or not available. We also calculated percent change where available to assess improvement or worsening of each metric, and this was based on a 5-tier system where 20% difference or more was labeled greatly worsened or greatly improved, 10 to 19.9% was worsened or improved, and then less than 10% difference was labeled as no change. Next slide, please. 25 metrics were selected for disaggregation by relevant groups, and disaggregated data is reported beneath the state overall value in the tables in each subdomain section and are the most recent data available. Next slide, please. Oh, this is out of order, sorry. Next slide. County breakouts. There we go. We analyzed county level data to show differences in the health and well-being of kids 0 to 5 in rural versus Appalachian or urban areas of the state. We used Ohio Medicaid Assessment Survey county type designations to do this analysis. Next slide, please. And finally, all the data that HPIO compiled can be found in the data appendix, which will be downloaded in the PDF format from the Groundwork website. There we go. Sorry. We're going to find more detailed source information and metric descriptions, as well as the percent change values, all available disaggregation demographics, and every single county level data that we pulled in. Thank you.
All right, let's move forward to the next slide. We are going to have a brief panel discussion for the remainder of our time. I have a few questions for our policy team and for the HPIO team, so the experts behind the document, and we'll go from there and see if we may have time to answer some additional questions that might not have been answered in the Q&A function. All right, so my first question is for Carrie, and I just want to understand, you at HPIO, you all are collecting and analyzing data all the time. And I think I just am curious, like, what was noteworthy about this time data collection process, and how are you viewing these findings in comparison to much of the other work that you're doing?
Yeah, thanks, Lynanne. So while HPIO has a history of work related to the health of children in Ohio, our focus is more generally on Ohioans overall, such as in our biennial health value dashboard. So what we found through this process is that it's much more difficult to get timely, accurate, and actionable data that is focused on young kids than adults. Mm-hmm. For instance, it's really hard to get data on healthcare claims and quality, just as an example. This is really important when we're trying to answer questions like, Is our healthcare system working the way it needs to for our young kids? Are kids on Medicaid getting tested for lead exposure at the recommended ages? So we need to be able to access that data in a timely and accurate way to be able to answer those questions. I also just really quickly want to add that related to our other findings, we found a similar thread in the work of the early childhood dashboard to our other work, that young Ohioans, like Ohioans overall, continue to be less healthy than kids in other states, that we could use our healthcare resources more effectively and more efficiently, and that not all young kids in our state have the same opportunities to thrive. And those are areas that we need to focus on.
Thanks so much, Carrie. And Lexi, I'm wondering if you can follow up. Carrie talked a little bit about the difficulty in getting disaggregated data for very young children, but has gathering disaggregated data on young children and families become easier or more difficult over time? And what factors do you think influence some of these trends?
Sure, thanks, Linan. I would definitely say that it's gotten more challenging. The pandemic really disrupted the timeliness of collecting and reporting on a lot of this data, and it seems like we're just now sort of starting to come out of that with a lot of the data available being 2021 and 2022. Fortunately, a lot of the data that's in the dashboard was compiled before the recent disruption in the federal administration data availability. So it didn't impact us in that way, but we have seen a lot of data become unavailable or go down and come back up in the last week or so. That was critical to the development of this dashboard and likely will be critical to development of future dashboards. So that's why it's so important for state agencies at this point to be publishing timely reports and data to fill in some of those gaps that we see at the federal level. Additionally, another challenge was regarding specifically disaggregated data is small sample sizes. I cannot tell you the number of times where we really wanted to take a look at children 0 to 5 in some of these smaller populations or marginalized or underrepresented groups, and we couldn't report it because the sample sizes were too small. So oversampling is just so critical to be able to understand what's happening with these populations.
Thanks, Lexi. I know we have spent many probably hours talking about what's available and what's not. There was a question in the chat about, how we determine what is available. And I just want to share that the HPIO team a few years ago, when we started down this pathway, we looked all across the nation about every data metrics that's available, and we did that again for 2025 because the more answers you get, the more questions you have, and it continues to be challenging. I am really excited to see that the Department of Children and Youth, they have their own dashboard now, and so we're regularly seeing those numbers move in real time. And they have that because they have data-driven goals. So I think that's been an exciting development too, but we're always challenged to tell that unique story about little kids, whether it's in a certain county or a certain racial or ethnic group. Caitlin, I'm going to pop over to you. What key takeaways from the dashboard kind of highlight the importance of Medicaid coverage and improving child health? We've recognized that Medicaid spans a number of our different categories of that we're tracking. Can you talk more about that?
Yes, absolutely. So yes, to your point, Linan, it's hard to categorize some of these metrics by specific sections because health and education are so intertwined. And Medicaid coverage for low-income kids is the foundation for so much of their ability to be successful, both in health and in their ready-to-learn outcomes. In our research, one thing that stands out to me is that we found the uninsured rate for children under age 6 is 5.4%, which ranks Ohio 29th among all 50 states. And we know that without Medicaid, this rate would be substantially higher. Medicaid coverage is crucial for ensuring access to essential health services during critical developmental years. And I think maybe some folks would be surprised to learn that Medicaid covers nearly half of all births in Ohio. So the Medicaid program is truly positioned to significantly influence maternal and infant health outcomes from the very earliest stages of life. And so Medicaid coverage is really vital for reducing disparities and improving overall population health. And I'll just include too, if I can caveat into the mental health space with regard to Medicaid as well. Groundwork Ohio really celebrated alongside our advocates the adoption of the DC 0 to 5 in House Bill 7 and at the end of the last General Assembly. And this is the DC 0 to 5 is really a reference material that can help to accurately diagnose, classify, and treat mental health disorders in infants and very young children, as opposed to the systems that were in place previously that were specific to older children and adults that just don't apply quite as well to the unique developmental needs of infants and very young children. And so through House Bill 7 and the adoption of the DC 0 to 5, we also have an opportunity to build a crosswalk for billing codes that can increase access to infant and early childhood mental health services for families across Ohio, just simply by creating that platform upon which these codes can be activated. So it's not the end all be all solution. It's part of the overall continuum of care that Medicaid really can provide.
Awesome. Thanks for sharing. I wonder if the HPIO team, do you have anything to add? I know you just put out an excellent updated primer on Medicaid and who it serves. Maybe we can drop that link in the chat as well. Is anything to add there?
Just that it is definitely a space that we're going to continue to watch and monitor over the coming year. I think that there is a lot of opportunity for changes to be made in that space, both at the state level and the federal level, that we're going to want to monitor and provide opportunities for advocacy and keeping informed.
Thanks, Carrie. Yeah, we have a lot of levers there. I think one of the frustrations we picked up on in talking about mental health, we were able to have a lot of metrics about what the need is in terms of the problem, like what families and kids are experiencing, but really not a lot about what percentage or what portion of that need is met or unmet by the availability of professionals. I don't know if Caitlin or Carrie or Lexi, you want to pop in and just share if you found any other helpful kind of trends or new data collection in that space, because it's increasingly a challenge for us to get beyond just this overwhelming problem and really understand where the gaps are.
I can jump in first, and then certainly Carrie and Lexi, if you have additional information, I welcome your feedback. But absolutely, we hear from families, and last year in Groundwork Ohio's roadshow, we heard in every region that we visited that there's a disconnect between the number of providers available and the number of families needing services. We know that infants and young children needing access to infant and early childhood mental health services certainly is increasing. We're seeing the preschool expulsion rate increase, for example, and that is certainly correlated with the increased need for mental health support and services, both for young children as well as their families, because we know that the mental health and well-being of infants and young children is also inextricably linked to that of their caregivers. So we are hearing a lot about long wait lists, lack of providers in certain areas, and we know that there are also specific methodologies and interventions that are especially effective with this population, and just an undersupply of providers that are specially trained in those supports and services that young kids and families need.
Thanks, Caitlin. Well, an open invitation to the participants as we continue to partner and seek out more data. I know a lot of local communities have more specific data that is really helpful in telling the story. We've been challenged at a statewide level, I think, to really capture this uniquely for young children. So we would love to work with you to figure that out, and for the next couple of years as we tell a broader story. Troy, from just touch on kind of from a process standpoint, you have provided leadership over both our qualitative and quantitative data that we've been getting from families. Can you talk about just how that works and what the importance of that is before we close our panel?
Yeah, quantitative data helps give us that big picture, and it tells us how many children are falling behind, how widespread the issues are, what are the systems that are serving our kids, what do their numbers look like, looking at child poverty, infant mortality, where do the disparities exist. But the numbers alone don't explain why these issues persist or how they impact the families in real life. And that's where our qualitative insights come in. When we listen to families, we can gain a deeper understanding of the barriers they face, whether it's struggle in accessing childcare, challenges in navigating the healthcare system, financial stress that impacts their ability to provide for their children. And these personal stories provide context, making the data more actionable, and integrating family voices helps us ensure that the policies that are designed are not just based on statistics, but on lived experiences, leading to solutions that really meet the needs of families. And that storytelling just transforms these numbers. When policymakers hear directly from a parent who had to leave their job due to lack of affordable childcare, or from a mother who credits home visiting programs with saving their baby's life, that impact is profound, and it personalizes the data, and it makes it harder to ignore and easier to act upon.
Thanks. So we're going to close out this panel with just one final question that went unanswered, I think, in the chat. This is a good one for HPIO. Can you talk about the ACEs data in terms of, that's been a real expertise of yours, but where it has come from? We've got someone in the local community that really is eager for consistent collection methods and talking about the ACEs screening. So how have we utilized this, and maybe give her some insight to follow up?
Sure. Yeah, I'd be happy to take that, Carrie. So that data specifically comes from the Ohio Medicaid Assessment Survey, which is collected every 2 years. And that is publicly available. They have a data dashboard. I'm happy to throw a link in the chat for the individual that's in the community that wants access to that data. We do have our own in-house analysis of that data set. That is what you see in the data dashboard, but please feel free to reach out. There are some counties where that data is available. It's very small sample sizes, again, coming back to that, especially for kiddos 0 to 5. But we were able to get enough data to report at the level of the federal poverty level income, and then also at the level of race and ethnicity.
When you're
Awesome.
looking at the individual county level or looking more locally, you're correct, Melissa, it's just the tip of the iceberg, and we definitely need better systems to be able to better monitor that.
All right, thank you. All right, we'll get our slides back up as we close out this webinar. Thank you all of you for sticking with us, and certainly feel free to reach out to all those experts on our panel on our team and at the HPIO team to help continue to move our work forward. Next slide, please. We just want to review a couple opportunities, big opportunities to engage. If you do nothing else, you need to register for our Advocacy Day on March 12th at the Ohio State House. It'll be a wonderful morning to network with folks from your community and across the state. We have a shared agenda that all of you have been important to contributing to, that we'll be elevating to your state policymakers on March 12th. We'll enjoy the morning together, and then we will divide and conquer by going to legislative meetings. Our goal is to meet as many different legislators as possible with geographic diversity across the state. So please join us there. Link is in the chat. Next slide. You know it. We have a morning meeting every Thursday at 9:30. We have some great experts coming up to continue to keep us in the know. And Brittany will make, from our team, will make sure you have the latest kind of budget engagement and insights as well. Next slide. And then finally, Troy has done a great job in leading our early childhood fellowship. If you're an early childhood professional, whether you're in childcare, you're a librarian, a home visitor, an early intervention specialist, clinician, if you serve and work with young children, please consider how you may contribute to your own expertise as an advocate. You know your job best. We know advocacy best. We want to partner with you to invest in your leadership in that way. Applications are live. They're open until March 14th. We expect to have a pretty competitive group, so get your application in as soon as possible. Next slide. That is a wrap, folks. Thank you. Please continue to work with our team and have a wonderful day and spend some time on some data. Thank you.